Yes, Sandra, welcome.
Thank you for having me.
Why should electrotherapy be applied in skin tumors in cats and dogs? What do you think?
Yeah, so it's a very promising treatment option for certain cutaneous tumors. Nowadays, like where we know that it has a really good response rate is for squamous cell carcinomas. So electrochemotherapy can achieve a really good control of the cancer without extensive surgery. So it can be a really good alternative to surgeries that sometimes can be disfiguring, like nosectomies or pinectomies. For other tumor types, I guess we know a little bit less about how effective electrochemotherapy can be. But we know that in those cases where surgery is not possible, in dogs with muscle tumors, in dogs with melanomas, and other tumors like sarcomas, it can also be beneficial and help shrinking the tumor. Or sometimes even make it disappear in the absence of surgery. So it's still an alternative. It's not my treatment of choice. I still would recommend surgery, but it can be a really good alternative in some patients as a palliative treatment, or when the tumor has been incompletely excised after surgery. Yeah.
Yeah. Okay, thank you. What is the correct clinical approach for patients with lung metastasis?
Yeah, that's a good question. And
Metastasis is key point.
Yes, because now obviously we are doing more imaging investigations in patients with cancer. So the more we investigate, the more lesions we find, and we diagnose more metastases than we used to diagnose 5-10 years ago, especially in dogs with aggressive cancers and cats with aggressive cancers. So obviously the treatment of metastases will depend on the tumor that we are dealing with. And there are tumors where we find pulmonary metastases, and the clinical behavior of those metastatic lesions is very aggressive, and they are likely to grow and progress over a short period of time. But it's important to acknowledge that there are dogs and cats with other cancers that are less or slower to progress. So dogs like with diagnosis of anal sac adenocarcinomas or thyroid, salivary carcinomas, these tumors, even in the presence of small metastases, those patients can have a relatively long survival of over a year with treatment. So it's worth acknowledging that some tumors may progress slower than others, and not all patients are good candidates for treatment, especially with chemotherapy in the presence of widespread metastatic disease, or if the prognosis or quality of life of the patient is poor. But there is a proportion of patients that even in the presence of metastatic disease, they can enjoy a good quality of life with appropriate treatment. So that's why it's important to distinguish and to acknowledge the clinical behavior of these tumor types.
Tumor types. Thank you. Lymphoma is very common. Yes. What are the main reasons behind its widespread occurrence?
Yeah, that's a good question. I'm not sure I have an answer for it. It's definitely one of the most common cancers we diagnose in dogs and also in cats. In dogs, more affecting the lymph nodes, and in cats, affecting the intestinal tract. It's probably a combination. Obviously, with cancer, is always a multifactorial cause that leads to cancer, particularly in lymphoma. We know that environmental factors like tobacco smoke can play a role, also some environmental pesticides, while genetic factors still play a very heavy role as well. So I think the more we diagnose, or the better diagnostic tools we have, the more our patients live, especially now that all the medical techniques are getting better. Our patients live longer, so probably that also leads to a higher incidence of certain cancers, particularly lymphoma. So yeah, it's difficult to blame one single thing. Probably it's a combination of things, but definitely is a cancer that is becoming more and more common. Yeah.
Last question is Klivet. How was the Klivet Congress for you?
was-
And are you happy to be here?
Yeah, it's been amazing. I've had a great time. I've met a lot of interesting
Perfect presentation.
people.
I listen
Thank
for you.
you.
Perfect. And thank you very much for coming.
I hope everyone enjoyed the oncology talks, and I'm having a great time. The food, the people, the talks have been amazing. So yeah, I hope everyone has enjoyed it as much as I have, because I've enjoyed the location as well.
Thank you. Thank you very much.
Thanks
Thank
for
you for
inviting
coming.
me.
Thank you for interview. Thank you very much.
You.